Um, as you guys know, we are seeing a really phenomenal increase in the number of cases in the state of Mississippi, and we're also seeing significant stress on our healthcare system, with a lot of folks having to be hospitalized. This is not surprising. This is something we've been seeing to come for a while. It's a sort of grand combination of a low level of immunity in our population, combined with the Delta variant and us being more active, and so it's entirely predictable. I do want to just sort of reinforce what we know about the transmission of the coronavirus right now. 93% of the samples that we looked at recently are the Delta variant. So pretty much everything out there right now is the highly contagious Delta variant. And we know that the majority of transmission is occurring among and from unvaccinated folks. 95% of our new cases are still among unvaccinated individuals in the state of Mississippi. But there's another thing that's happening that is new and really concerning, is we're seeing some spillover from unvaccinated folks into certain subsets of vaccinated, especially older individuals and those who have weakened immune systems. We have seen that now of our hospitalizations, 87% are unvaccinated, which is still an overwhelming majority, but we do have a minority of folks who were previously vaccinated. And if we look at our deaths, now it's 80% of our deaths are in unvaccinated, but 20% are in vaccinated individuals. And by and large, these are people over 65 who have serious underlying medical issues or have serious immunocompromised states. And that's something I'll talk about in just a second. If we look at other trends, we are concerned about increasing transmission within younger age groups. I know we shared some information that showed that we're seeing increased numbers of hospitalizations in people under the age of 50. That has been increasing significantly in recent weeks. And sadly, we're reporting the death of a 16 or a teenager in the state of Mississippi who died from COVID. We now have 4 deaths in children in the state of Mississippi, 2 in the age range of 11 to 17, 1 between the age of 6 and 10, and 1 between the age of 1 and 5. The recent death had an underlying medical issue, but it was a common medical issue. It's nothing that people don't live with every day in the state of Mississippi commonly. So this is a real tragedy and speaks to the importance of us preventing transmission. Although severe outcomes in children are rare, when we have a whole lot of transmission, we have a lot of cases, we are unfortunately going to see this type of tragedy from time to time. So very, very sad to report that. Most of the cases we are seeing is Delta, and that really is playing a part because it's twice as contagious as previous variants. So that's a super big challenge, especially when we have the vast majority of our kids who are not immune, either because they haven't had infection or they're not immunized. So going to be a big challenge going forward. And the other thing is there's been a lot of questions about boosters. We do know that certain subsets of our population, especially people who have weakened immune systems, people who are on cancer chemotherapy, transplant patients, people are taking medications because they have autoimmune disorders and have to suppress their immune system. Those sorts of folks we know do not generate significant immunity after 2 doses all the time. And that's a subset of population that we want to talk to your doctor. Right now, we're recommending that folks talk to their physician. It's a personal, it's a physician-patient conversation about what to do to remain safe. Some of it's going to be about taking precautions, but some of it's going to be seeing about, is a booster dose, which is basically just an additional dose of what you had before, is that the right pathway into the future? So stay tuned on that. We're continuing to interface with CDC to see how to move that forward, but it is something that some physicians have chosen to do in Mississippi to date, and it's something that we support as a reasonable approach for individuals in the context of a physician-patient relationship. That's all I have for my update right now, and I'll turn it over to Dr. Byers.
Dr. Byers?
Yes, thank you.
Okay.
Good afternoon, Dr. Dobbs. And I am going to share a few slides with everybody just to kind of give us an idea and reiterate some of the information that Dr. Dobbs did go over. So give me just a moment here and we'll get those up and going. And hopefully everybody can see our slides. We are in, as Dr. Dobbs indicated, in substantial and high transmission of COVID-19, really in all parts of Mississippi. We have seen the majority of our cases in unvaccinated individuals, the majority of our hospitalizations and deaths in unvaccinated individuals. But as Dr. Dobbs indicated, we have seen breakthrough vaccination cases where individuals who are fully vaccinated may be infected, hospitalized, or in some circumstances, we've had deaths in those individuals as well. So with this highly transmissible Delta variant that we have that is circulating and causing an estimated more than 93% of the cases that we're seeing in Mississippi right now based on our surveillance data, we are aligning with CDC to update some public health guidance to prevent the transmission and control the spread of COVID-19 in Mississippi. First and foremost, that starts with COVID-19 vaccination for all eligible individuals. And just as a reminder that individuals 12 years of age and older are now recommended to receive a vaccine. That does include women who are pregnant. The vaccine has been shown to be very safe and effective in pregnant women. But in addition to the vaccination, now, and again, this is aligning fully with guidance from the CDC, that everyone in Mississippi, including those individuals who are fully vaccinated, wear a mask in public indoor settings. Additionally, we're recommending that if you are exposed to someone with COVID-19, regardless of your vaccination status, that you should get tested after that exposure to determine if you have infection. We are seeing now that individuals who are fully vaccinated, who are infected, may in some cases be contagious and may be able to spread the virus to other individuals. Now, if you're not fully vaccinated, we do still recommend quarantine. And certainly if you're infected, we recommend that you isolate. But we're not recommending right now that individuals who are fully vaccinated have to quarantine. But we do recommend that they get tested after exposure to be on the safe side, to identify if there's a potential that they've been infected as a result of that exposure. We're also recommending, and these are recommendations that we had previously, that if you're 65 years of age or older, you should avoid indoor mass gatherings, even if you're vaccinated, or if you have chronic underlying medical conditions, or if you're immunocompromised or immunosuppressed for any reason, either through medication or through medical conditions, that you should also avoid those indoor mass gatherings, even if you've been vaccinated. And let's take a look real quick at what we are seeing. As you can see, based on this data, we are having rapid increases in the number of our cases that are being reported in Mississippi now. It's a pretty astounding increase that we're seeing at the moment. And we're really not seeing that this is leveling off at this point. We are seeing deaths. We have seen some gradual increase in the number of our deaths as well. We're also seeing a higher percent of test positivity in Mississippi. So not only have we seen increases in the number of people seeking out and being tested to determine if they have infection, we're seeing a higher percent positive in those tests that are being conducted. And that's an indication as well of the burden of illness that we're seeing in all parts of the state. If you look at a snapshot in comparison for 2-week periods between June 30th and July 13th and July 14th and July 27th, you can see an astounding increase in the number of cases that are occurring on a daily basis. 5,000 compared to over 12,000 in the most recent 2-week period. If you look at deaths, we are also seeing increases in the number of those deaths, not to the same extent of the cases, but certainly this is also concerning. And again, as Dr. Dobbs indicated, the overwhelming majority of those deaths are in unvaccinated individuals. Dr. Dobbs did mention that our hospitalizations, ICU visits for COVID, and people on the ventilator as a result of COVID infection are also increasing. And you can see from this graph the rapid increase that we've had in the number of people hospitalized with confirmed COVID in the last month. Again, another indicator of the direction that we're heading in with COVID and with the Delta variant. We're also seeing outbreaks in our long-term care settings and nursing homes. And you can see that from low levels that we had in mid-June, we have now rapidly increased in the number of our long-term care outbreaks that we're seeing. We currently have over 100 long-term care outbreaks in Mississippi. 72 of those are in nursing homes. The primary driver of those nursing home outbreaks are infections in unvaccinated staff and employees. And regrettably, in some cases, these infections are spilling over into the residents and into fully vaccinated residents at times. So it's going to be imperative that we continue as healthcare workers and healthcare staff in long-term care settings to increase our vaccination rates among those employees, which are still below 50% across the state and lower in some facilities. Unfortunately, some of these cases in residents do result in severe illness. So we do recommend that, and we actually have a health officer order out there now that requires that all long-term care staff either are vaccinated or are tested routinely in the long-term care setting in an effort to identify those cases and remove them before transmission occurs in those settings. As Dr. Dobbs indicated, the driver of what we're seeing is the Delta variant. You can see how quickly the Delta variant has become the predominant strain in Mississippi. Through our surveillance, as I indicated, we estimate that over 90% of the cases that are occurring are due to the Delta variant, which is the primary virus that we are seeing circulating in Mississippi that is causing illness and infection. As regarding our vaccinations, we have had some minimal increase and in the vaccinations over the last couple of weeks. So we hope that that's been interest from the public because of what we are seeing now with the rapid increase in cases and hospitalizations across the state. But you can see that we still have low numbers of vaccination rates in our 12 to 15 years of age group and our 16 to 17 years of age group. It's important to remember that although most times these individuals who become infected have minimal to mild symptoms and recover, there are deaths that do occur in individuals under the age of 18. There are hospitalizations that occur as well. And so we encourage all parents to get your children vaccinated. This is going to be a key to not only protecting your children, but preventing transmission in the school settings, preventing transmission into the vulnerable population, especially those individuals that they may share a household with. When we look at our vaccination rates for Mississippi, you can see that we are still lagging behind the US rates in a number of age groups. Although we're doing better in our fully vaccinated over the age of 65, we still have over a quarter of that population that is not fully vaccinated. And unfortunately, we are still seeing deaths that are occurring in that age group and in the age group over the age of 50 as well. So it's imperative that we continue to improve our vaccination as the route forward to limiting transmission of the Delta variant that we're seeing right now. The vaccine is still very effective against Delta variant. And not only is it effective at preventing illness, it is also effective at reducing the risk of severe illness. If you look at our cases, and Dr. Dobbs did mention this data, and this is updated data as of today, that 96% of our cases are in unvaccinated individuals. 88% of our hospitalizations are in unvaccinated individuals. Over 80% of our deaths are in unvaccinated individuals. And if we look at the age breakdown for these, you can see that the majority of our deaths are still occurring in individuals 50 and older, and these are largely, overwhelming majority, unvaccinated individuals. Now, the last thing that I did want to talk about was school guidance. And again, we are going to review the CDC guidance, and it's likely that we will be aligning our school guidance with CDC's guidance as well, to recommend that all students, teachers, staff, and visitors in indoor settings, in the school setting, wear a mask at all times during indoors, regardless of their vaccination status. So stay tuned. We will be sending that additional guidance out. And I'm going to turn it over now to Mr. Craig, our Senior Deputy.
Thank you, Dr. Byers. And based on some of the information that you just heard about our increase in hospitalizations and the stresses on our healthcare system, today we're issuing an order once again requiring all Mississippi licensed hospitals to participate in the Mississippi COVID-19 System of Care Plan, effective tomorrow, July 29th, 2021. In parts of our state, hospitals are struggling to accommodate the acute clinical demands that they're facing with the increase in hospitalizations. So, consistent with the COVID-19 System of Care Plan, we will enact a COVID-19 rotation to help ensure the proper assignment of patients to an appropriate hospital. Our response partners in the COVID-19 System of Care Plan have all been alerted to the order and are prepared to help us support this order. And operationally, to facilitate the order, we've activated the Mississippi MedCom. They serve as our state medical response communications facility, as well as the patient transfer coordination point. They'll begin to assist hospitals in directing patients to available beds, and when no beds to hospitals, if no beds are available, they'll start helping to rotate to destinations on a rotating basis, really based on the geography and the resources available in that area. This current order will be in effect till August 15th, 2021. In addition, this order will also look at ways to potentially increase some available resources within hospitals. Monday, August 1st, hospitals must begin to delay certain elective procedures that require overnight hospitalization. And this should increase our critical resource availability within these hospitals. And that order is also effective through August 15th currently. We'll share just a couple slides on some information about our testing. You know, Dr. Byers mentioned some of the testing that's going on in the state and what our positivity rate looks like. If we look at health department or MSDH sponsored testing requests through our scheduling system, we see that same increase in the requirements for testing that began shortly after the July 4th holiday. And we continue to see increases in testing demand in the state of Mississippi. To help with that, just as a reminder, we do have free testing or no-cost testing available to all Mississippians throughout the state. In areas where they're not private providers that are providing that testing, the health department has a contractor that's working either at our Capital City location, which is the farmers market location at Weston and Woodrow Wilson, and these other locations around the state. Note that the demand has really increased at our Capital City testing location here in Hinds County, and we have doubled the capacity to be able to provide for the demand in testing at that location. We also have moved Rankin County to a 5-day per week testing location to meet the demand in that particular county. We continue to monitor the testing availability throughout the state to ensure that free COVID testing is available to all Mississippians. To schedule a COVID test, you can go to covidschedule.umc.edu, or you can call the Mississippi COVID hotline. They'll be glad to assist you. Also, remember that free vaccination is now available at all county health departments during the days that they operate. It is free. If you want to make sure that your wait time is minimized, please make an appointment at covidvaccine.umc.edu, but walk-ins are also available. The reminder, we continue the effort across the state to do pop-up vaccination sites. These are kind of local short-term where we come in usually on a Wednesday through a Saturday and provide vaccination opportunities in a central area of the county, if that's identified by the county government and the officials, or in some cases is multiple locations in the county where a vaccine is made available. In all those locations, we use the Pfizer vaccine, so it's available for anyone 12 years of age and older. There is no documentation or identification that's required, and we usually come back in around 3 weeks to provide second doses in these areas. Also, while we're in the county, we try to make sure that if there are any homebound that are ready for vaccination, that we provide that vaccination opportunity, as well as institutional settings and long-term care facilities that may have additional individuals needing vaccination efforts. So if we look at our pop-up locations for this week, we find that we'll be in Clay County at the Boona Community Center in Prairie, Mississippi on Wednesday and Thursday, and FEMA Voting Precinct in FEMA, Mississippi on Friday and Saturday from 9 to noon. We're also in Hancock County at their Kiln Shelter from Wednesday through Saturday, providing vaccination. In Waynesboro at the City Auditorium, Wednesday through Saturday, providing vaccination opportunities there. And in Poplarville at the Pearl River Community College, we'll be there Wednesday through Saturday as well. Finally, in Tippah County, we'll be at the Mississippi State University Extension Office in Ripley on Wednesday, Thursday, and Saturday, and at the Walnut Volunteer Fire Department in Walnut, Mississippi on Friday, July 30th. Just as a reminder, vaccination opportunities are available not just with the health department, but with a lot of our providers, pharmacies, community health centers, and other practitioners around the state of Mississippi. So vaccine is widely available in the state. Please take the opportunity to avail yourself to vaccine if you've not been vaccinated yet. I'm very, very thankful to those partners that are assisting in the vaccination efforts. Remember that vaccination is making a difference. And while it's gradual and we'd like it to be a lot more robust, please continue those efforts to get folks vaccinated. Remember also that 96% of practicing American doctors have received the vaccine. So if there are questions or you're concerned about vaccine, visit with your providers. We found that patients trust their doctors, and that's a good source of information for being able to get vaccinated.